In this video, we are going to illustrate home exercises for the multiligamentous knee injury. Warning: the home exercises recorded in this video do not replace the advice and exercises given by the doctor and physiotherapist, nor do they replace the required appointments with the physiotherapist. These exercises should not result in pain, and if experienced, stop the exercises that cause this immediately. Do not force any movements that the knee will not allow, as this will cause further damage. An overview of the knee joint. The knee joint is composed of three bones: the patella or kneecap, the femur or thigh bone, and the tibia or shin bone, which is connected by four major ligaments that provide stability, namely the medial collateral ligament or MCL, the lateral collateral ligament or LCL, the anterior cruciate ligament or ACL, and the posterior cruciate ligament or PCL. A multiligamentous knee injury is defined as a complete cruciate tear of either the ACL or PCL and a partial or complete tear of the collateral ligaments, either the MCL or LCL, or it is a complete or partial tear of both of the cruciate ligaments. So, why is exercise important? It has been shown to restore the knee stability, as well as the range of motion, which means you could move it in the directions it is meant to be moved. And the main goal of exercise is to return to the pre-injury level of function or activity, or as close to this level as possible. We will first focus on non-weight-bearing exercises, which is the initial exercise regime for any knee injury. The first type of non-weight-bearing exercise is the quad sets, which focuses on the muscles on the front of the thigh. To do this, you will be sitting with your legs out straight in front of you. You'll then place a towel or pillow under the knee that is injured. You will squeeze your thigh muscle as well as your buttock muscle and hold this for 10 seconds and then slowly release. You will do this 8 to 12 times depending on the pain that you feel. Hip abduction and adduction. Lie flat on your back and lift your leg about 10 centimeters off the ground. Move the leg outwards as far as possible or until pain is reached, and then move it inwards towards your body and then cross your other leg and return it to its normal position. This must be done 8 to 12 times. Toe exercises. For this, you could be lying on your back or sitting upright with your legs straight out in front of you. Try limit this to your toes only by pointing them and then pulling them back towards your face by straightening them. Try avoid using your ankles for this exercise. Ankle exercises. Again, for this, you could either be lying flat on your back or sitting upright with your legs straight out in front of you. You must point your toes towards the ground and then pull it up towards your face. This exercise requires that you use your ankles rather than your toes. Straight leg raises. For this exercise, you will be lying flat on your back. Bend your uninjured leg and then raise your injured leg up about 10 centimeters off the ground. You will then hold this position for 10 seconds and then slowly return your leg to its original position. Repeat this exercise 8 to 12 times. Prone hip extensions. For this exercise, you are required to lie flat on your stomach. Raise the leg with the injured knee up straight as high as possible. Hold this position for 10 seconds, then slowly bring it down. Repeat this exercise 8 to 12 times. Passive knee extension, which is an exercise used for those that cannot straighten their knee fully. Hang your uninjured leg off the bed and then place a towel, blanket, or pillow neatly folded under the ankle of the injured leg. The elevated ankle allows gravity to work on the knee, which forces it straight, or as straight as possible, without forcing it into a position that it is not ready to be in. Hold this position for 10 seconds and then remove it and wait for another 6 seconds, and then repeat this exercise 8 to 12 times. Heel slides. Lie on your back for this exercise and bend your injured knee and slowly bring your foot towards your buttock, then return it to its original position and repeat 8 to 12 times. Heel dig bridging or hamstring sets. Lie flat on your back and bend both your knees up as well as your ankles so your feet are pointing up. Then squeeze your stomach muscles as if you are going to the toilet, and then bring your buttock up towards the roof to ensure that there's a flat line between your knees and your chest. During the lifting process, your ankles are pushing into the bed and your stomach must remain tight. Hold this position for 10 seconds, then slowly bring the buttock back to the bed and repeat this 8 to 12 times. This video will only focus on one weight-bearing exercise, the half squat. Stand with your feet shoulder-width apart and your trunk straight. Then bend your knee and move your buttock towards the ground, but stop 45 degrees above the ground or when you experience pain. Do not try a full squat at this point. Hold this position for about 10 seconds and then return to your starting position. Repeat this exercise 8 to 12 times.